The 2008 financial crisis hit a lot of families hard. Millions of Americans suddenly lost their jobs and struggled to make ends meet. This extreme stress had a devastating effect on some children. A 2013 paper in the journal Child Abuse and Neglect studied this period of time and found that the recession resulted in higher rates of spanking. This behavior has been linked to greater chances of families being contacted by Child Protective Services. So when millions were laid off more than a decade later due to the pandemic, child abuse advocates feared for the worst.
We have to look at things like hospitalizations and emergency department visits and reports. And unlike car crashes that are, pretty well, everyone knows when a car crashes, child abuse is a little bit more complicated because a lot of it is hidden.
That's Dr. Robert Sagi, director of the Center for Community Engaged Medicine at Tufts Medical Center and a child abuse pediatrician at Tufts Children's Hospital. The medical team calls Sagi in anytime there's suspicion of abuse with patients.
We do a very straightforward protocol to help identify these situations. And about half the time we end up reporting those cases to the state for further investigation. And about half the time after we complete our investigations, we say, no, this was caused by this or that, and it wasn't child abuse. So we're the experts on figuring out whether a particular injury or condition is likely to be the result of abuse. And this is to help our colleagues to make sure the system is done with expertise.
But Sagi points out that making this determination is not always straightforward. So as schools across the nation switched to remote learning, experts worried that child abuse would go even more unnoticed. However, Sagi was part of a team that studied children's emergency room visits in 2020 from March to September. Their 2021 paper, published in American Medical Association Pediatrics, shows actually a decline in visits during the pandemic. Other studies have tracked a similar decrease while researching various traits of maltreatment.
Others have noted a decline in hospitalizations for abusive head trauma, which is the most common form of child abuse in the first year of life. And the national data shows that child abuse reports fell during the first part of the pandemic. And the interesting about the reports is that they fell far more than could be explained simply because schools were shut down. So schools shut down. Schools typically report about 20% of child abuse cases, and the reports declined 40 to 70%. So a lot of other things were going on.
Sagi also conducted surveys with parents during the pandemic. The reports show parents had a relatively low use of spanking.
They also reported that they were having fun with their kids, and most important, they reported that their relationships with their children were growing closer during the pandemic. So all of these things taken together suggest that actually child abuse fell during the first part of the pandemic.
He says several factors impacted this decline. The government stimulus checks helped keep people on their feet after so many had lost their jobs. The $600 increase in weekly unemployment benefits also eased financial stress. Sagi says people were going through hard times, but this additional assistance meant that they weren't feeling desperate, a key idea he thinks helped protect children.
As a child abuse pediatrician who's been doing this for quite a while, what I've seen is that most families who abuse or neglect their children are really stressed out. They may be facing economic problems, they may have mental health problems, all sorts of things go on, but there are relatively few, very few people who are actually evil and wake up and think, today's the day I'm going to hurt my child. So what we know is that helping families with these concrete supports can decrease child abuse.
Despite the evidence suggesting a decline in child abuse during the early days of COVID, some arguments say that abuse doesn't simply go away. In February, the Children's Bureau released its Child Maltreatment 2020 report. It shows that investigations and calls to child abuse hotlines plummeted. But is this a promising sign or a product of isolating abused children? Sagi agrees child abuse doesn't just disappear, but he says cases do rise and fall.
All of the data suggests there's been a decrease in child abuse in the first part of the pandemic. So visits to the emergency department for child abuse went down. Hospitalizations for serious child abuse went down. And parents When we asked 9,000 U.S. parents about their family situation at home, reported that they were growing closer to their children. So there's all these very independent data sources are all going in the same direction. And I think that they really legitimize the fact that the number of reports to child protection agencies around the country went down. Because it's hard to imagine how everything goes down and child abuse didn't go down.
In an effort to collect all the data on how the pandemic has affected child abuse, researchers conducted something called a systemic rapid review. Ashley Rapp, an epidemiologist in the Department of Public Health at Henry Ford Health System, was part of that review team.
We took a kind of broad picture of all of the articles that were currently out about child maltreatment at the time of the review. So December 28, 2020 was kind of the cutoff. So any article basically published on the topic by then was included in this analysis. To specify, though, we tried to make our search very broad so that we could, first of all, kind of capture everything that was relevant to the topic. However, we did a very rigorous review process to determine what exactly would be relevant for data extraction.
They used a strategy called the PRISMA Guidelines. It's a rigorous checklist that allowed RAP to look at various scientific articles while making sure all data was evaluated as accurately as possible.
We really did start off with a really broad understanding, I guess, of what child maltreatment looks like during this time, but ultimately we're able to capture specifically what was going on in real time, because we did this whole study as the pandemic was unfolding, right? So we were able to look at, what was going on early on with the stay-at-home orders, and then eventually how the year 2020 played out.
And at the end of their review, researchers found that the scientific articles ultimately contradicted each other.
Based on the papers that we saw, we know that a few of them were documenting increases in child maltreatment. A few were documenting decreases. And one even said, there was no significant difference in child maltreatment trends. So there's a lot of disagreement, at least during this time, in the scientific community about what could be happening and what these numbers mean. So what was kind of interesting is truly the variability in findings, right? Like, it really exposes this complex relationship as a situation is developing. We saw a lot of different ways that researchers looked at child maltreatment trends. Were they looking at hospital reports? Were they looking at crime reports? Things like that. And it exposed that during this time, specifically during the height of the pandemic and the stay-at-home orders, we can't for sure say what the child maltreatment situation and what this landscape looked like.
If all of these studies are scientific and factual, how can their findings be so different?
So we know that all of these people really performed these statistically and methodologically sound studies, but did find different things. And a little bit on why they might be conflicting is that they were assessing data from different sources. For example, one of the studies that we looked at was looking at crime data, right? So what is being reported to the police department? And that's very different from what data is being reported via the hospital and healthcare system, right? So a lot of times it comes down to the reporting. Certain things do get reported to the hospital that don't get reported to the police, or sometimes when somebody calls into the police station, they might not necessarily need to be seen for a hospital visit. It's really important to think about child maltreatment as this multifaceted thing, right? It's not just specifically a certain type of abuse.
Child maltreatment can be psychological and emotional as well as physical. Rapp says a person's geographic location can also have a big impact on how well abuse is reported.
If you live in a community where you don't see the police as being someone you could trust, because historically the police have not been very trustworthy to people in your community, obviously you are not going to want to report something to the police because that's not somebody that you go to. And I think that that's kind of important to think about for all sorts of public health issues right now is who do we trust to report data to? Are people collecting data on our community? This is something that I think about a lot. I'm Chaldean, my family's from Iraq, and I notice when it comes to reporting that my community is not as often or accurately reported on as, for example, typically a white community, right? There's way more data out there about them than about the Arab population.
Which leads to less accurate data for populations that don't feel comfortable reporting to the authorities. Rep says this difference in findings shows the need for greater analysis. It's just not possible for one study to tell the whole story. You can find more information about Dr. Robert Sagi, Ashley Rep, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence.
Coming up, how a new mine in Nevada is working to reduce their environmental impact when Radio Health Journal returns.
Coming up next week on Radio Health Journal.
We're saying if you meet criteria for prolonged grief disorder, you are at risk for being suicidal. You are at risk for having high blood pressure. You are at risk for having a heart attack.
The new controversial diagnosis recognized by the American Psychiatric Association.
Then the brain disorder that's flown under the radar in football.
The NFL has done, I think, a good job with concussion, right, and managing concussion protocols. But this isn't a disease about concussion.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The coral animal itself actually has a translucent skeleton.
Did you know that colorful underwater coral reefs are actually living animals? Then,
it's a masterpiece of using building materials to create an artistic effect.
It's safe to say there's nowhere in the world quite like the Big Apple. I'm Marty Peterson.
And I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.